Obesity, excess of adipose tissue deposit seen in greater than 20% children in urban India, energy intake greater than expenditure, deposition of adipose primarily in the abdomen, central obesity increases risk of complications. Note, body has limited capacity for storage of fats but not carbohydrate or protein. Definition: parameter body mass index for children greater than 5 years, weight upon height into 100, overweight greater than 23, adult equivalent, obesity greater than 27, adult equivalent. Weight for height for children less than 5 years, WHO weight for height chart 2 to 3 SD overweight, greater than plus 3 SD obesity. Skin fold thickness, subcutaneous fat, Herpenden caliper greater than 85 percentile obesity. Waist circumference indicator of abdominal obesity greater than 75 percentile, greater than 80 per centimeter in girls, greater than 90 centimeter in boys. Waist hip ratio age independent, ratio of waist circumference to hip circumference greater than 1 in male, greater than 0.85 in female. Waist height ratio age independent greater than 0.5 is obesity. Etiology: obesity, constitutional, pathological, usually child is of short stature. Causes: excess food intake, inadequate exercise. Characteristic: child has tall stature, greater insulin like growth factor, generalized obesity. Causes of pathological obesity: monogenic causes, endocrine cause, hypothalamic obesity, and drug. Monogenic causes: heredity, single gene defect, positive family history, mineralocorticoid 4 receptor defect, leptin deficiency, leptin resistance to leptin, uncontrolled appetite. Note, leptin deficiency was the first reported monogenic causes of obesity. Endocrine causes: Cushing syndrome, truncal obesity, buffalo lump striae, moon face, hypothyroidism, pseudohypothyroidism, growth hormone deficiency, hypothalamic obesity, lesions in the ventromedial nucleus, satiety center, uncontrolled appetite. Causes: head injury, radiation, tumor, infection. Rapid onset obesity, hypothalamic dysfunctions, hypoventilations, autonomic dysregulation. Syndromic obesity, Prader-Willi syndrome, genetic imprinting disorder, hypogonadism, small hands and feet, almond-shaped eyes. Beck-with-Wiedemann syndrome, obesity, macroglossia, organomegaly, hemihypertrophy. Lawrence-Moon or Beadle-Bardet syndrome, clinical features, LM syndactyly and BB polydactyly. Obesity, hypogonadism, intellectual disability, and retinitis pigmentosa. Drug: anti-epileptic drug, valproate, lamotrigine, and steroid cushingoid appearance. Complications: metabolic complication, obesity, increased adipose, insulin resistance, metabolic syndrome, PCOS in women, insulin resistance, acanthosis nigricans, hyperpigmented velvety patches on neck and axilla. Non-alcoholic fatty liver disease lead to steatohepatitis, inflammatory changes in liver, chronic fibrosis. Management of obesity: lifestyle management, no response then medical management, no response then surgical management, which is last resort, laparoscopically adjusted gastric banding, which increase the capacity of stomach, decrease the food intake. Decrease the capacity of stomach and decrease food intake. Lifestyle management is sugar should be avoided, sweetened beverage, packed food, fat, trans and saturated fat should be avoided, unsaturated fatty acid An intake of unsaturated fatty acid and vegetables and fruits, less intake of salt, physical activity increase greater than 60 minutes a day, moderate to strenuous exercise. Medical management treatment of endocrine disorder, all orlistat inhibit the gastric and pancreatic lipase, decrease the fat breakdown and absorption. GLP analog liraglutide slow gastric emptying, less than fat absorption. Metformin indicated in known diabetes, women with PCOS.